Advanced Orthopaedic Specialists want to advance the health of Northwest Arkansas by eliminating pain and helping people move again. And if you're looking for that kind of help, our next guest is who you want to know. Dr. Devin St. Clair joins us with more. Thanks for being here, Doctor. Great to see you.
Yeah, thank you guys so much for having me on. I appreciate it.
So are you one of the newest members of the team there?
I am brand new. We started seeing patients last week.
Wow.
So we're getting started, but we're getting busy fast.
Yeah. Tell us a little bit about your background.
Yeah, I'm from Joplin, Missouri, so just right up the road. I went to the U of A for undergrad, got my biology degree. The University of Missouri stole me away for a few years. I went there for medical school, and then I stayed there for residency, met my wife somewhere in between. And then I went to Vanderbilt University for my spine fellowship. So I am a orthopedic spine surgeon, bringing that to the Northwest Arkansas area. That fellowship training gave me training in all of spine surgery, but with a focus in minimally invasive spine surgery.
What does it mean for you to be able to move back to Northwest Arkansas?
It means the world. Well, I'll say my wife is the biggest driver in bringing us back. She's the boss of the house, as I'm sure you guys know.
Sure.
But U of A was a home for me. You know, it's where I kind of grew up as a college student, and I'm the perfect distance to my family.
That's great.
That's good.
Yes, I love
So you kind of touched on this a bit, but can you tell us more about what you specialize in specifically?
Yes. So I'm an orthopedic spine surgeon, so I can handle any spine surgery, whether it's the neck, the mid-back, or the lumbar spine. But our focus is minimally invasive spine surgery. Specifically, something called endoscopic spine surgery, which is a newer technique that we're doing in the spine surgery realm. It's only been around for about 5 or 10 years. But I have a whole fellowship year of training in this technique, and it's very similar to when we do knee scopes or shoulder scopes, which is called arthroscopy. We can do the same thing in the spine now, where we just make a tiny incision, stick a camera in, and take care of business.
That's fascinating to me, because when I think of spine surgery, I think of something that's invasive. I think it's going to take weeks, months, years to heal from that. But you've really reduced that time frame.
The goal is to treat people with as minimally invasive of a surgery as possible, so that we can get them up and back to their lives as quickly as we can. And when we are able to do endoscopic spine surgery on these patients, they essentially have no restrictions after about 5 days.
Really?
I tell them, go back to your life, go ride a horse, work out, do whatever you want to do.
That's quick.
That is amazing.
What do you find that are some things or some pitfalls that we should stay away from to be preventative so we don't have to come see you?
That's an excellent question. I tell all of my patients I don't want to see them again because it means that they're doing better. Safe lifting habits is one of the biggest things. So lift with your legs, not with your back. Weight loss is the biggest one, and it's the big elephant in the room that I have to talk to a lot of patients about. But every pound that we put on our body frame is an extra 4 pounds on our lower back. And so
that's what it equates to?
Roughly. It's different for body shape and sizes, but that's a rough estimate. And so when we lose weight, it takes a significant stress off of our back. And then the last thing is core exercises. Core exercises, which includes the abs and the lower back, takes a lot of stress off our back.
I'm not good at that. I'm not good at
Yeah,
that.
okay, so
I'm not either.
You just give me a checklist of things that I need to do so that I don't come and see you. But just in case folks do need to come and see you, maybe just for a consultation or to find out what's going on, how do they do that?
You can call our office. We'll put the number on the screen, I think.
Sure.
Yep, excellent, perfect.
Got the address and the number coming up.
And what we offer is a comprehensive spine approach. So we have non-operative spine doctors, specifically Dr. Kent Hagen, and he will handle everything from therapy, medication, injections, all the way up to surgery. I see a lot of those patients along with him so that I can discuss those surgical options with the patients. And then hopefully we get you back to your normal life as quickly as we can.
That's the goal.
Awesome.
That's right.
Well, thanks for joining us today.
Yeah, thank you.
Thank you.
Absolutely.
Absolutely.